Recent Department of Health Services data shows that 86% of Wisconsin students had the minimum immunization requirements last school year.
And that's a 3% decrease from the previous year and below the target for measles vaccinations. Now it's raising concern now that measles is confirmed in our state. UW Health's Dr. Jeff Pothoff is back to talk with us about this. Welcome back.
Hey, Dr. Pothoff.
Yeah, Wisconsin did pretty well for a while avoiding this, and now here it is.
Yeah, I mean, we've talked about this a couple of times where measles was kind of like all over the place, Texas, even in the northern states, and it missed us, but now it hasn't. And we're worried about it, right? Because we're not a well-vaccinated state, so it kind of creates a little bit of angst about, what could happen if we see more cases.
Let's look at some of the statistics from DHS, because we are very low when it comes to this kind of vaccination. Why is that?
Yeah, we're the third lowest vaccinated state for measles, and I think one of the reasons that that's the case is it's very easy to get an exception to not vaccinate your child and still be able to go to school. Most states will have a medical waiver, which is a physician says, in very rare instances, and even in Wisconsin, this is less than 0.5%, the vaccine is a problem for you, shouldn't get it. And then there can be religious exemptions, but even that's kind of hard because there isn't a large major worldwide religion that completely prohibits vaccination. But in Wisconsin, they also have the personal conviction, which is kind of your get out of jail free card. If you don't want to vaccinate your child, you sign that personal conviction form. You don't have to vaccinate your child, they can still go to school.
So really, that could be anything?
Yeah, whatever we define personal conviction, that seems pretty broad.
So this is 9 cases right now in Oconto County, which is near Green Bay. Do we have any evidence that it is spreading to sites in the area, or was this a group of people that traveled somewhere else?
Yeah, so thankfully, it looks like we did get lucky this time. So they were identified as having traveled to an area that had measles. The Department of Health quickly contact traced these folks, kind of isolated them so that they weren't out in public. But the concern is if one person with measles goes to a movie theater, there's 100 people there that are unvaccinated, 90 of them will come down with measles. It is one of the most contagious viruses known to man.
Wow. So is that part of the message that health officials are trying to get out there? Some key things?
Yeah, I think it's a little bit of a wake-up call because I think, before a couple of years ago, you could have probably been okay in saying, what? Measles, what is that? That's not a disease we have in the United States. That's like, vaccines my grandparents got, and maybe made a decision not to vaccinate. But now, measles is in the United States. It's all over the place, and it's in Wisconsin. That redoes the calculus on whether it makes sense to be unvaccinated against something that caused a whole lot of problems in the 50s and 60s.
Can you get an MMR vaccine at any age? It's traditionally given to young kids, but can adults get it?
Absolutely. If you're not vaccinated, get vaccinated. The other population that may want to consider it is if you were vaccinated against measles, but it was between 1963 and 1967, that vaccine wasn't quite as effective. You would likely benefit from a booster. But otherwise, if you're vaccinated, got those 2 doses, 98% chance that if you're in that movie theater, you're not going to get measles.
Dr. Pothoff, thank you very much.
Great to see you. Thank you so much.